there anything else you want to tell us about the normal anomaly initiatives in your organization?
Yeah, it's centered around HIV advocacy, but it is not an organization that focuses on HIV. We focus on racial and social injustices, and we want to just always make it clear that focusing on HIV is focusing on racial and social injustice. Is focusing on white supremacy. It is focusing on how Black trans lives can't matter just for a hashtag, and how we can't wait on a hashtag. It is focusing on how sex work is work, especially. I was talking to somebody just real quick, and I'll let Titan take this over. But this brings up something. I was talking to advisory board for an organization, and the organization is looking for someone that has some expertise around substance use and substance abuse. And I found it so interesting that the first thing on the employment application was a master's degree. And I said, okay, cool. The second thing on the application was no felony background. I said, oh, so you want somebody that knows substance abuse from theory, not someone you want from personal experience, because likely if you've had real substance abuse or substance issues, you likely don't have a master's,
Right.
and or you have a right.
Right.
So it's really important for us to keep these things in context, and so that's why I'm always pushing the envelope. Will not end any epidemics between Black and brown bodies against queer and non-straight. Well, let me know. Queer and non-heterosexual males, even though heterosexual males, that's the whole thing, Joe, which I can talk about in the common questions, because I think that we miss out on straight males and their allyship and the things that they need also. But we won't be able to end any disparities on Black bodies until we really expand this and call it what it is. It's white supremacy.
Yeah, yeah. I think that Ian hit it right on the nail. Excuse me, on the head of the nail. I think that Ian and I have had, probably like you and Joe have had conversations. We have conversations all the time about certain things, and we would see in the community, and we would say to ourselves, okay, wait. So what happened was, one time I went to, just to be real quick, I went to I call them gatherings. Ian liked to laugh when I say gatherings because I am Southern, even though I'm Southwestern. But I went to a gathering that was supposed to be a safe space. And I walked into that space or that place, and it wasn't safe at all. And I told Ian, as I stood there and I looked around, I saw our community, and I thought to myself that I'm a part of this. Like, I am truly a part of this because I'm being quiet. I believe silence is violence. And so I was just being quiet because I didn't know where I fit in. But as Ian stated, the normal anomaly became that radical organization to stand up and say, okay, this is not what we're going to do. We're going to go out and talk to our trans sisters and brothers. We're going to go out and talk about sex work. We're going to go out and make sure you know, because just like he said on the application, how you going to have somebody with a degree or with a master's that you want expertise in drug use? Like, how does that even work? Like, how does that work? Now, through theory, it works, right? But we already know that if you have anything, you have experience.
As you said, the body is already giving you signs. So, what are some signs, especially when we're talking about HIV? But you can include STDs. But what are some signs that a woman should be looking for to indicate that, hey, something is not right? I may have contracted some type of STD. Other than we know, like a smell, but other than that.
Well, of course, there's the typical vaginal discharge. Sometimes a woman will bleed after sexual intercourse, and what the bleeding is not necessarily representative of HIV, but what it does is that it calls for her to go to her provider to get it checked out. So if you're bleeding with sexual intercourse. If some women actually, believe it or not, they have the thrush on the tongue, and it's very painful. You know, they may have really thick what is it? Yeast, a very thick yeast infection that will cause them to go to the provider, and in turn, hopefully the provider will test them for the whole panel of STIs, gonorrhea, chlamydia, syphilis, HIV, even down to maybe herpes, trichomoniasis. There's so many of them that actually a woman needs to get tested for. And by the way, if you are sexually active, ladies, if you're sexually active at the age of 12, you still need to have a STD panel, period. They can do a pelvic exam. They don't have to do a pap smear. Pap smear is when you're actually taking cells from the cervix. They don't have to do that. But a provider may do a pelvic exam just to look around and make sure everything is okay. If you are having sex, you need to have an STD panel workup.
Okay, so I got my man brain on.
You were going where I was finna go.
Yeah. What's the difference between the pap smear and the pelvic exam?
Like I said, the pap smear actually, believe it or not, the American College of Obstetrics and Gynecology actually stated that a woman does not have a pap smear until the age of 21. What the pap smear does is that the woman has the vagina, and then entering into the uterus is what we call the cervix. The cervix looks like a donut, believe it or not. And what it is that we go in and we have like a plastic tool that is called a speculum, a spatula, and we take cells from the cervix and we put it in solution and we send it off, and it lets us know whether or not those cells are okay, whether or not they're precancerous. That is what a pap smear did. A pap smear is a cervical cancer screening. That's what. A pelvic exam is same thing. The speculum is put in, but we're looking around inside. We're making sure that the tissue, the vaginal tissue, looks good. We're making sure that everything looks okay with the cervix. We're not taking cells, but if there is discharge that may look out of either watery or greenish or yellow, we may take a sample of that, look under the microscope to see if we see anything. So that's the difference. One collects cells for a cervical cancer screening, the other just examines the vaginal vault as well as the presence of the cervix.
So when okay, so that's a really good question. Acknowledging who you are and the issues that you're having with this journey, right? So if you create a goal for yourself, or if you mark a goal, then you need to discuss with yourself. So that's that insight piece. What is stopping me from achieving this goal? Why haven't I had issues all of these years? Right. And then you write down the different issues that you've had in terms of the type of food that you eat, the times that you eat. When you actually go to food, like is food an issue? So like when you're feeling sad or upset, or you happy, are you fellowshipping over food? Are you binging on food, or are you mistreating or abusing your intake of food? And then is, what am I using the gym for, or am I exercising? Am I using it to just accomplish this goal of looking a certain way, or do I want to be overall healthy in different aspects of my life? So that's where mindfulness comes in. First, again, knowing the definition of mindfulness, accepting the different aspects of ourselves that's keeping us from reaching the goal after we set the goal, and then reminding ourselves that being self-aware of what we need to do in order to reach the goal. So that's what mindfulness does. Mindfulness provides these reminders in the present moment, and it allows you to not judge yourself. So also, you fall victim to the streets, as Tupac would say, by not going to the gym, not eating what you need to eat. It's just okay. Don't judge yourself. That was that moment, but guess what?
Mhm.
Go to the gym in 30 minutes, get there, or you can go to the gym in the morning, get there. Or in case you did have a 20-piece wing from Wingstop.
Yes.
However, this evening, what we need to do is make sure that we flush a good amount of that out. So we need to drink more water than we typically would during the day, and maybe end our day with a salad, a nice long salad to help flush that all out. So that's what
Mm.
mindfulness does in that type of situation. Is it actually just reminds us of what we need to do and keeps us honest with ourselves.
Right.
Right.
Okay. Okay.
Okay, you said flexitarian.
Right. You know that was my other question.
Yeah.
You know, I
What's
say a sometimes a Terry, that means I sometimes eat a vegetable deal, or sometimes I eat some meat, or sometimes this. But what is a flexitarian?
So, in being mindful, I listen to what my body needs. A long time ago, I was in high school. I stopped eating pork. When I was about a sophomore in college, I stopped eating beef, and then I became vegetarian over those years, and then started practicing veganism. But then, because I wasn't getting the micronutrients that I need, even though I thought that I was knowledgeable, I wasn't used to practicing what I needed with my schedule, right?
Mm.
So I was lacking micronutrients, which then caused me to become anemic. So I need to start to incorporate more intake of iron, not just from supplements, but also from food. And so I started back eating different types of feed that were high in iron. But then over time and educating myself, I just decided to pull back from those two. But if my body tells me that I need something specifically, I'm going to eat it. And that's what I mean by flexitarian. I don't um, subscribe to just one category in terms of my diet. If my body tells me I need something, I'm going to do it. The other thing is I'm really big on culture and family. So if my mom's cooking something, she knows how I am, is how I like food prepared, and it's nostalgic to me, I'm going to eat it because my mama made it. And she's only
Mhm.
here for a certain amount of time. So that's what a flexitarian is
Okay.
being flexible with yourself, still responsible, but being flexible with yourself, not subscribing to just one type of lifestyle diet.
So you basically saying, so if I see, you know how most people say, oh, I'm vegan, I'm healthy. That doesn't mean they're healthy. Or I only eat chicken, or I only eat fish, or I only eat, most people don't eat just beef. But you know what I'm saying? Or I just not a vegan, but a vegetarian. So it, because those are all different types of, I guess, diets, or I don't know,
Lifestyles.
lifestyle modifications that they seem to choose. So just because I'm one of those doesn't mean I'm healthy. I can still have health issues because you know when most people say, "Hey, I'm a vegan," they think they automatically healthy because they're skinny, they're thin, they're, you know what I'm saying? So does that mean that they're not always healthy? So if I just
Absolutely.
switch over to a different diet and say I'm a pescatarian today, I'm more healthier because I'm a pescatarian?
No, because it's all about the macronutrients and micronutrients that we're getting in. It also is about your mental health as well. So if you switch over to be vegan, but then you start to subscribe or judge people for eating meat, then that means that you are exhibiting toxic behavior just because of your own personal choice, right?
Hmm.
So, no, I actually trained for 2 bodybuilding competitions for the figure
Hmm.
category. And during that time, I had to intake a lot of protein, right? So I'm eating a lot of fish, a lot of fish. But there were a good amount of foods that I could not eat that are
How you do that? How you do that? And then in school they gave you the egg or a bag of flour to take care of, and you had to take care of it
Yeah.
through the weekend.
Yeah, but see, not my favorite part of outreach is the education. I love
Hmm.
to go, and whether like I was just telling somebody this the other day, like I don't care where we do the classes. I've done classes in lunchrooms, down the hallway from the bathroom, all the way almost in the bathroom, on in the cafe, or not the cafeteria, but in the auditorium, in classrooms, outside. Should we've taught classes in vehicles? You
Hmm.
wherever I need to teach it, I teach it. But I love to see people's light switch come on when they get
Hmm.
it. Like, you know, you're out in the community and you're talking to somebody, and in their mind, well, you can't catch an STD in your mouth, and then
Hmm.
you not only tell them that you can catch an STD in the mouth, but you show them how it happens, and then the light switch comes on. Like we've said this before, like the young man who his whole thing was, I only use magnums because we only supposed to use magnums. But then we introduced him to different condoms, namely the non-latex lifestyle, and when he used it, his mind was blown. And then when we had other young men who was coming up and was saying, man, I'm not using that condom because it doesn't have the brand name that Magnum has. So he had this other young man who was around that age, probably got some respect from them, and he's telling them the same thing we telling them, and the other young man looking at him like, you for real? Then he tells them that his experience. And they're like, oh man, yeah, let me try them. And it's powerful because another thing too about doing outreach and out here helping people is you got to learn how to take your butt off your shoulders sometimes, right? Because you may be great at delivering a message, but you may not be the best person to give this message to this specific group of people. So how you can make yourself handy is teach others. Now go back to what you was talking about earlier, going into the community. One of the most powerful things we did was started educating gatekeepers. Find you the gatekeepers, educate the gatekeepers. Like we have women who work the streets who pass out condoms for us, and when they see us, they stop us. Hey, I need some more condoms to pass out. Then kind of find out when you talk to the men or other people in the neighborhood, they're like, hey, I know y'all need to get some more condoms. And we're like, oh wow, this is really working. So it's getting into the neighborhoods and the communities, finding out and understanding how the community works, the breakdown, and how things flow, what people do this and what people do that. When you start to understand that will make you more of a powerful asset versus from the outside looking in, and I'm just going to force my way into your community, and I want to force my ideas and my information on you. We seen it at an outreach event not too long ago. It was okay. We still have to understand timing and understand the culture of the people that you serve.
Thank you, James.
So we're gonna go ahead and jump right into it and go ahead and get the interview started.
You got the first question. Do it.
You know it. Can you tell the audience who you are, your professional background, and why you chose to work in the public health disease prevention area?
Sure. As was mentioned just slightly earlier, my name is James Easton, and originally I am from Miami, Florida, North Miami. And I've been working with the Department of Health since 2008. That's about 13 and a half years now, give or take. And believe it or not, as Joe had mentioned, I started my career with the Department of Health working as a secretary, the HIV prevention program assistant in the Department of Health. I kind of took a $7,000 pay cut to come and start working for the Department of Health, sort of get in the door kind of thing. And yeah, I spent 5 years working in that position, making sure that condom distribution and supplies were really expanded. In that time I was working, I think we multiplied the volume of condoms distributed, I think by 1,500%. Wow. It was huge, but that's the whole plan. The idea is to make them available throughout the streets, everywhere people could possibly need them and encounter them, to get them for free, specifically ones that they'll want to use. Right. Which is very important. But I worked in the central offices then. I worked for the patient care program for about a year and a half, and another couple of years with the ADAP program as a contract manager and as a consultant for that. So I learned the care side of it, the Ryan White side of it, doing that. Went back to the prevention program in a programmatic role after I went back from patient care to do the state linkage coordinator position. And I think a combination of all those jobs, the learning the programs and the rules across them, really set me up to be in a good position to take on the role as a HAPC, because being well-rounded and knowing what the staff are supposed to do and what the federal requirements are is really important. So beyond that, I think it's really rewarding working in public health. I get a great deal of satisfaction from helping people, from knowing that the work we do is helping someone better their lives, helping them stay healthy or get to a point where they can move forward and have a better life. I spent while working through college and before working for the Department of Health, I worked in lots of jobs where I was very successful at making other people rich. And I made good money, and, you know, it's nice to be told, oh, you do such a great job. But, you know, making one person exceedingly wealthy and not really helping the community didn't satisfy my soul. It didn't help my heart feel better. So once I finished college, one of the first things I did was applied for a job at the Department of Health, a couple of them, in fact, and took one that I could get specifically in HIV, even though it was a really big pay cut, about $7,000, because I specifically, you know, it's a field that I care about,
Right.
very much, you know, and the opportunity to help people and be there doing something that was really going to help people was something I couldn't pass up.
And I think that
it kind of took my strength in a lot of areas. I had a conversation with my daughter, her senior year in high school, and I was driving her back and forth to the doctor to get her physicals and everything like that. And we were having a conversation in the car, and I was saying to her, I hope that you all, my worst fear is that my children will grow up hating me because of the decisions that I made and how it impacted the family. I'll never forget what she said. And she said it so strongly that at 17 years old, Dad, don't ever say that to me again. Because you are my daddy, and I would never hate you. We will never hate you. And she said that we missed the money that you used to make. But other than that, you know, that's the way that was. And it's hard having a conversation. I mean, we had conversations. I mean, every year after we found out, we had conversations with our children as they grew up, so that they can understand it, because you have stages of growth, so they really understand everything that we have gone through, and we made it our decision not to keep secrets anymore.
Right.
Okay. And that was the experience that I can remember most.
So you kind of flipped it. You did the negatively and then went to the positively. So negatively, you know, it just really changed the dynamic of our household. You know, like my husband said, he wasn't able to be the breadwinner that he had always been, you know, and that affects everything. That affects our psyche. It affects your psyche. It affects the relationship, how we function. So to me, those were the negative impacts. But the positive impacts is we had to make the choice and the decision to work through those. So I think positively, we've gained some things, you know, in who we are, in our mind, body, and our soul. We've gained some things and we've learned how to be innovative. We've had to pivot and do different things to be creative. You know, when we didn't have that much money, we had to be creative about how to fix the meals and what to do, you know, what to do about the children's clothes and different things. So I believe the positive, you know, in respect to the negative, is that we gain some things that we probably wouldn't have gained, you know, without these challenges in front of us.
And with the program that we were in initially, I mean, it was just a fantastic program, and they didn't treat us like dirt.
Okay.
They treated us like human beings that needed help, and that helped us tremendously to get up on our feet and help my wife and my kids to get some things that they needed, the day by day things, you know. So it turned, what was negative turned out to be a positive, because now we can share to different couples and share to the world. Like I said before, that it's not over.
Right.
You just got to take care of yourself now.
Right. Right. Yeah. And I'm happy you said that. There are a lot of people. I love what I do. I love working in HIV/AIDS prevention. But the part of my job that that I enjoy it, but it's a bittersweet. And I don't want to frame it like that, but the sweet part is I get to help somebody help themselves, but I don't enjoy telling somebody that they're HIV positive.
Yeah.
I don't enjoy that part, but I enjoy being able to lay out a plethora of resources in front of them.
Yes.
Let them know that, you know, you have a whole community of people willing to help you and here to help you.
Or the period was.
The period was around 1969, if I'm not mistaken, right, Janelle? And it basically was a place in pretty much, basically, I would say New York City. And it was a place that kind of like a neighborhood, and that's just like an area where the LGBT can go together, have fun, non-judgmental zones. So it's like a safe haven, in other words. And basically, the police came in and just started attacking. And that one time, the people just was like, "We tired of it," and they started to fight back, like Janelle said. So it's just like a safe place that somebody went to that enough was enough. And it's kind of like if you look at the Black Lives Matter movement and different things like that, people are getting tired of things and not able to be who they are. We're in a century or a decade or years where we should be able to express ourselves no matter what. And so for the riots to happen back in the around 1969, it was a time for our people who paved the way for us to fight, to say enough is enough. If I wanted to wear a dress and a wig, let me be who I am. I'm not bothering anybody. It shouldn't matter, you know what I'm saying, what I'm doing. If I wanted to dress as a girl, it's okay. It's okay for people to be who they want to be and live the lives that they want to be. If I want to be with a man, it's okay. It shouldn't bother people for who I'm being with. And so they just basically got tired for wanting to be who they were, for just, you know what I'm saying, just putting up with the hate, because I would consider it to be hate because they didn't understand a certain type of culture or they didn't understand something. And people shouldn't be treated like that. So this place was basically a place for people to, one of the places were for them to basically just be who they want to be in a comfortable place. But the police came back and they just started arresting people, seeing people, you know what I'm saying, putting in vans. Normally people would just scatter away and just run because that's what happens when you see the police a lot of times. But this time they did. And so I think it's a monumental thing for people just to stand up for themselves and their rights for what they believe in, because we are in a country of freedom of speech, you know what I'm saying, where we should be able to say and feel how we want to feel, and it'd be okay. And people just have to accept some of the things that we say.
Right. Okay.
So Joe, too, really quickly, also, you know, to explain a little bit of why we were fed up. Well, you know, during that time, the community was so fed up. You know, the police had an agenda. You know, a lot of times, sometimes the police actually set up like say for instance, there was like if there was a park, you know, where people met up at. Sometimes the police would, do undercover ops just to put, set themselves up as like, they'll dress up, really alluring and things like that. And even as far as like, having some sexual contact just to get people arrested. For having, being gay.
Right.
So, and these were multiple times and occasions where police raided clubs or raided different areas, just harassing the community. So that's where the whole fed up type.
Right. Thank you. Yeah, thank you.
It was specifically targeted for, absolutely no reason.
Okay, so my question for you. You have this history of mistreatment, of discrimination, even of violence towards your community.
Mm-hmm.
You have those things happening right now. What gives you the courage to be an advocate, to be an activist for a community, knowing that it could put you in danger? What makes you say, forget all of that, I'm still stand up for my people?
from a very small age, I've always felt the way I have felt. And I've always had questions on, you know, why do I feel this way? Because I was told that it was wrong, right? So having the liberty of being who I am today, I feel empowered. I feel, I don't know, I feel like myself, I feel important. Right. Every day I have to, you know, wake up and I look in the mirror and I feel great. I feel good and I feel empowered of being the person that I am. So what pushes me is, you know, I have to go out here every day. You know, I have to, you know, walk out of my door, my front door, and I face all types of people every day. You know, my kids are concerned about my safety too sometimes, you know. And it's important because, you know, well, okay, let me backtrack a little bit. So back in
2005 by Bit Being Cares. So for those who don't know, it's a lot of people who have an idea what Bit Being Cares is. So could you give a history of Bit Being Cares as much as can? Who founded it? Why was it founded? And how did it grow into the entity that it is today?
So it was founded in '85 as an all volunteer. So same time I'm in Delaware, founded by Virginia Kirkland, I believe, Kirkland, Virginia for sure, as an all volunteer organization in '85, and then was incorporated in '87. And it really was direct response to the HIV crisis.
Okay.
And at that point, no money, no grants. Ryan White didn't start until 1991.
Right.
So no HIV prevention money, no HIV care money, just really grassroots donations, buddy system, companion services, and really the staff was really just taking care of people who didn't have anybody else,
right,
as the clients were passing away. That really was the onus.
Right.
And then the Ryan White CARES Act passed in '91, and we were selected in this area, Tallahassee, and well, at that point it was 14 counties, to be the lead agency. And that started the whole Ryan White Care, and you know, it's evolved over the last 30 years now to what it is now. In sometime in the early 90s, 92, 93, we Basic of Northwest Florida, Valerie Mincy, who's one of my best friends, over in Panama City. They and their agency split off from us. So what was Area 2 in Florida became 2A and 2B.
Right.
And Valerie and Basic sort of went on their own way with their 6 counties, and we kept 8 over here. And then it pretty much went along with that. You know, new grants came in from the CDC for HIV prevention, HOPWA and housing, various funders, you know, MAC Cosmetics and other Broadway Cares, and lots of foundations popped up. Bill Gates Foundation, you know, the same stuff you guys know about, started popping up around HIV and managing the disease and looking for a cure, and because it is preventable. It's a completely preventable disease. So all that started, and then in 2000 and to be our 25th anniversary, so 87, 25, 2012, we started with the 340B pharmacy program, and as over the last 5 years, made the commitment as a board in their 25-year strategic plan to by year 30, which was 2017, to start and build our own clinic on the south side. Very similar to what you're doing from me right outside my window. To move away from just being social services, but also to bring wraparound services to all our patients, but also to bring, with the Affordable Care Act, a lot of our uninsured patients that were go into bond and neighborhood because you guys handle the uninsured for almost all the Ryan White. Now they have insurance cards and they want to go see a private physician and they want to go to, see a private medical provider. But when they get there, they realize all you really have is the insurance card. You don't have transportation. You don't have,
especially in that specialty.
So for, and this is for our women who watch this podcast, and shout out to all the ladies who watch the podcast. How important, and I know for some people they may think this is a crazy question, but how important is it for women to receive their regular gynecologic care? The annual pap smear, the examination, and this is me as a guy who don't really know much about it.
Yeah,
so
great question. It's a great question.
How important is that care, and how does the pap smear examination play a role in examining the overall health of the vagina or the whole area to be able to help improve the health?
No, it's a great question, and it's not a dumb question, because not only are there women out there that don't understand that, there are even people in our own healthcare profession that may not completely appreciate what it is that we're doing at these annual visits. I think it's kind of a soapbox of mine. I'm glad you brought it up. I think that it got a little confusing when our pap smear guidelines changed some years back. And now, so for some people, they might not need a pap smear every year. And so they may hear from their doctor, we've never had an abnormal one. We're not seeing the HPV virus. Your screen is normal. We can extend that interval. Some people 3 years, some people 5 years. But what's really important to know is your gynecologist is doing more than just a pap smear at your well woman or your OBGYN visit. So as you brought up, there are actually, several different structures in the gynecologic system that are equally important. To clarify, the pap smear is only screening for cervical cancer, cervical abnormalities, in effort to try to pick something up in its earlier states, as in the cells are becoming abnormal, even if it hasn't completely developed into a cancer yet. So you can intervene before a cancer actually develops. So even if you don't need to have a pap smear that particular year, your gynecologic exam is super important. The doctor is looking at the vulva on the outside. They're looking for lesions, because you can also have pre-invasive, meaning pre-cancerous lesions or dysplasia, abnormal cells there. They're taking a speculum, looking inside, looking at the vaginal tissue, making sure there's no lesions there, making sure the cervix looks normal. And importantly, they are feeling on the exam called a bimanual exam, because you're using two hands. One is usually on the inside of the vagina and the other's on the woman's abdomen or outer pelvis above the pubic bone there. That is oftentimes how a pelvic mass would be detected. If there's a bulge there, a density there, a mass there, or maybe the uterus is enlarged. These are all things going through the doctor's head well beyond the pap smear. So it's important that women don't confuse the recommendation that they don't need a pap smear for a few years. That does not mean they don't need a gynecologic exam. That should be done every single year.
Okay, that brings up a great point, because Joe probably know where I'm going with this. So in most of our classes, when we teach about STDs and sexual health, we always let the ladies know that just because you got a pap smear does not mean that you don't have an STD. Can you please tell them that they do not test for STDs in a normal pap? Those are tests that have to be requested. Because most people say when they get a pap that I got all my STDs and they said I'm good. So can you please break that myth down for us, please?
Absolutely. So your pap smear, the whole purpose is specifically to test for cellular abnormalities that lead to cervical cancer. Every once in a while, you might pick up something additional, but even so, you're supposed to confirm that with the appropriate testing. And yes, that is a different swab. And there's a whole panel of sexually transmitted infections that can be tested. Some are picked up with a swab or a culture vaginally. Some are a blood test. Some can be tested in the urine. I think it's really important that women be transparent with their care provider. it is a no judgment zone, and they can only help you if you are completely honest about anything that may, involve exposure to an STD. And really, if you are, sexually active at all, and especially with more than one partner or not using protection, these are conversations that are so important to have with your doctor, because absolutely a full panel of testing is important.
Right. Okay. I am glad you cleared that up for me and others, because stuff, and I can come have a conversation with you and not feel like you're going to be looking down on me and anything. Like, no, you're a real person and you shoot from the hip. I like that stuff. People who shoot from the hip. But it's just, but that also translates to us addressing the health issues and taking care of the people in the community, because you're like, okay, I have a mindset of I'm not different from these people. Mm-hmm. This is my job, but I'm the same as you all. So how would I help myself?
That's right. Like I tell you all, treat our patients like the relatives you like. Mm-hmm. Okay? That's how you treat everybody that comes through the door. Treat these patients just like the family members you like. Okay? Right. Because at any given moment, that could be you. At any given moment, it could be your sibling, your family member, your friend. That we're not going to treat people. You treat people exactly the way you want to be treated. And if you do that, I promise you it'll be just fine. And we meet the needs of the people. Yeah.
And we're able to do it in many different ways. So we're definitely out here having fun now.
It does make a difference when you come to work and you feel good.
Yep.
Even though we make it look fun, it's a lot of work. Sometimes we make it look easy.
It's a lot of work.
It's a lot of work. It's a lot of late nights that people don't see. They think it's a Monday through Friday, 8 to 5, but all three of us can tell you it's not. We make it look easy.
Yeah,
it's a lot of blood, sweat, and tears that go into holding and taking care of the community.
Mark told me I had a fake maternity leave, so if that helps anybody to understand.
Yeah, because
you did.
But you're looking at three people who have similar mindsets when it comes to getting things done. It's like we're gonna go above and beyond to make sure that our community is taken care of and the job gets done on a satisfactory level.
That's right.
Mm-hmm. All right. So with that being said, we've talked about neighborhood before, but we want you to brag on neighborhood. So kind of give people, for those who don't know, this is their first time watching this podcast, give them an overview of what Neighborhood Medical Center is and how we serve the population and how you are able to serve the population as a CEO of Neighborhood Medical Center.
So for those of you all who have been hiding under a rock and don't know about Neighborhood Medical Center, we have been around since June of 1974. We started out as a small clinic for uninsured and homeless. We've since then grown. We had our main location, the hub was at the Brevard Street location inside of the Lincoln Center. From there, when we expanded our service locations, we went to the Smith Williams Center over on Pasco Street, and we opened a health center in Havana at the Cecil V. Butler Health Department building. Those two locations are still alive and well and thriving. From there, we expanded through a new access grant, we expanded to the Orange Avenue location. Orange Avenue is inside the Richardson Lewis Health Department building. We also have a mobile unit for that location. From there, we opened up a school-based clinic in Havana and at James S. Ricketts High School. So in the Havana Magnet School and at James S. Ricketts High School. Now, with all those locations, we have a new one coming soon. Neighborhood Medical Center, again, on the south side of Tallahassee. Very proud about that. But in those locations, we provide primary care, mental health services, dentistry. We are very proud to have an OBGYN program. Neighborhood, we are taking care of babies. We have a pediatric program where those babies, when they're born from the OB program, mom can take them right over to our pediatrician. We're very proud of all the services we provide. I must also say that we have case management services as well. My job here is to make sure that the day-to-day operations are taken care of at Neighborhood, and to make sure that Neighborhood is visible so that we can fulfill our
brightness on the horizon. So thank you all.
You're welcome.
Yes, sir. So, okay, Mathias, let's do this. You got the first question. Let's kick this off.
All right. Can you give us some information about your medical background and why we should educate about stroke prevention and treatment?
So for my medical training, all of that was done in Gainesville. So I am a Gator.
Okay.
Wrong territory.
So, I know, but I came up to Tallahassee because there's a lot of need for what I do, and it turned out to be a good partnership. So I did my medical training, medical school in Gainesville, and then a residency in neurosurgery in Gainesville, including a fellowship in something called endovascular neurosurgery. And that's really a field where we treat disorders of the blood vessels of the head and neck through minimally invasive means, usually through the artery in the leg, the femoral artery. And a lot of what we do now is stroke treatment. And things sort of evolved, and our group kind of became the dominant group taking care of patients with stroke in Tallahassee. And so that's sort of my background. I think the second part of your question was, why should we be educated about stroke prevention and treatment? Well, because it's a big problem. We have, it's the #1 cause of disability in the U.S. 800,000 strokes a year happen. Every 40 seconds, somebody in our country has a stroke. And every 4 minutes, somebody dies of a stroke. And so it's a big deal. It's one of the leading causes of death, but it is the leading cause of adult disability. And unfortunately, it's more common in the South. The southeastern United States is called the stroke belt because we have a disproportionate number of strokes compared to the rest of the country. And so I think it's important that everybody in our community know a little bit about stroke because it happens here, and you need to seek treatment quickly, and that's really important.
Right, the stroke belt. I've never heard that before. We're pretty familiar with the disparities, especially us working in HIV/AIDS prevention. So we know like the diabetes map and the HIV map, and a lot of disparities is heavy in our region in this Bible Belt, but never heard stroke belt before. That's new.
Well, it's real. It's real. And if you go to the Centers for Disease Control, the CDC, they have a map of the United States that's color coded that shows you the preponderance of stroke in the Southeast, and you can kind of imagine this belt across the country.
Right.
And we're kind of like in the buckle in Tallahassee.
You spent time along your medical journey. You're in medical school. You're studying. You're learning. How did you get into the field of stroke prevention? Is that something you were always interested in, or did it pique your interest as you were matriculating along your journey?
Really, it became a focus of what I do after all my training was done, once I was in the community. And so as I went through residency and fellowship, there was sort of a revolution in stroke treatment. So when I started off, like 2004, there was one treatment for stroke, and that's TPA. It's a medicine that we give IV. It helps dissolve blood clots. It pretty much was the only treatment for stroke back then. And as I went through, there were a number of developments kind of along the way in the field of endovascular neurosurgery that proved that some of the procedures we do, where we go in to the artery in the leg and navigate catheters all the way up to the head using X-ray guidance and physically remove clots and blood vessels to restore normal blood flow, that stuff became relevant because it first came out and it didn't look like it. Maybe it's helpful, maybe it's not. And as those things evolved and a couple of different devices came out, it was shown to have a very huge benefit for eligible patients. And so as I came out of training, that stuff was just happening. And so we started doing stroke intervention here in Tallahassee in 2012, just as I started in practice. And, it's kind of interesting because I went to a few conferences that year and I heard some prominent speakers speak about neurosurgery and stroke, because typically neurosurgeons aren't involved in stroke. It was neurologists. And one of them, I remember him saying, in order to be relevant in the next 20 or 25 years, neurosurgeons are going to have to be involved in stroke care. Initially when I heard that, I was like, that's never going to happen. But he was right. As things moved on, as we became more and more involved, it became more of a, an interest and a passion, and really what it became was there was a tremendous need in the community for a comprehensive stroke center. And so TMH and the administration and my group, Tallahassee Neurological Clinic, sort of
brain health. And why would you say people should focus more on brain health rather than just physical fitness or any other type of health?
Yeah, absolutely. So they're kind of all linked together. So we think a lot about heart health and physical health and mental health, and those all have an impact on the brain as well as kind of in the other direction. So, not a lot of people pay special attention to their brain unless it's kind of causing them issues. That's when you start to think about it. But, we only get one brain ever in our lives. We can get a liver transplant if we need one. We can't get a brain transplant. And, brains tend to not be very good at healing from damage, whether that's from an injury or a disease, a disorder, or even, things like poor blood flow can cause issues with our brain. And our brain really isn't that great at healing and reversing that kind of damage. So it's really important that we, think about our long-term quality of life, what we want for our future and our later years, because how well we take care of our brain throughout the spectrum of our entire lives is going to have that impact. I tell people you're never too young or too old to start kind of thinking about these things that take good care of your brain.
Right. Okay. So like another part of the body could possibly heal faster from an injury. So I break my leg and I have some kind of injury to my brain. The leg would heal faster and maybe stronger than the injury to the brain.
Right. And we can often, if there is an injury or damage to the brain, there are things we can do to compensate for that. But as far as kind of reversing that damage or replacing those brain cells, we do start to lose brain cells around 30 years old, and we don't generate new ones.
Okay. Oh, I got you. That makes sense. So if you're already losing brain cells and something happens that could possibly contribute to more brain cells, it wouldn't be anything to help repair those brain cells.
Right.
So have you ever read or heard about or seen any studies or anything that someone is doing to help regenerate brain cells or repair brain cells?
There is some research out there. As far as dementia research goes, they have not yet found a way to repair damage that's already done. They found some treatments to slow the progression of someone with a neurodegenerative disease, so dementia, like an Alzheimer's or something like that, to kind of slow that progression. But the research isn't out there yet on reversing or replacing that loss.
Okay. Now, it's interesting, though.
I want to pause that on that note about case management right now. We're going to come back to that because I do want you to get into that. I don't think people understand the importance of case managers. And I think case managers and social workers are very underrated. But Big Ben cares. So a lot of, even before CarePoint was built, a lot of people ride down South Monroe, and you see Big Ben cares on the left-hand side. Those of us who are from Tallahassee, who've been here in the 80s and 90s, that's the old firehouse building. So we pass by it. We don't really know what it is. I'm from the south side of town. Before I start working in the public health realm, it was another building I passed by. So for those who have no idea what Big Ben Cares, or for those who think they know, could you tell us what Big Ben Cares is, and how does Big Ben Cares go about caring for its patients and providing services?
Absolutely. So I mean, basically, we're the local HIV and AIDS service organization. Now, it's kind of outdated because there's a lot of us who work in HIV and AIDS. But, when you say we're the lead agency, that all that really means is the funding that we receive goes to one particular agency in an area.
Right.
All of the areas of the state have a lead agency. So it doesn't really mean that we're the leaders, you know. I mean, people like to think that that's what it is, and like you said, the telephone calls and the gossip stuff. But we're no better than any other agency. We just happen to be an HIV and AIDS service organization. So, you know, we're providing prevention services in the community, and we're providing case management services for people living with HIV, just like Neighborhood is doing and just like Bond is doing. But you know, we also, just like Neighborhood and Bond, that's not the only thing that they do. And now for us, now that we have CarePoint, you know, that's not the only thing that we do. So it, you know, it's obviously something that is needed with all three of us being here, because all three of us are extremely busy. You know, there's plenty of people who need us, plenty to go around, unfortunately. You know, I mean, it's not like we're fighting over people.
Right. Yeah, we definitely not fighting over people.
You know, I mean, I do think people need to understand that one thing that's really very good about this area is we collaborate really well.
Yes.
You know, I mean,